Welcome to Better Health Together, and today I'm with Sandra Higgins, and Sandra is the Chief Executive Officer of Comwa, and Comwa is the provider of the Peer Pathways program. For many of us, we take for granted the ability to manage our health and well-being and our ability to be able to interact with providers and navigate the system. But for a lot of people with mental health issues, navigating the system and navigating their activities of daily living can be a real challenge. And that's where Peer Pathways comes in. Sandra, in terms of Peer Pathways, where did the Peer Pathways program come from?
As a member-based organisation, we have always provided people who've phoned with assistance in navigating what are quite complex supports and services in WA. For us, the particularly special thing, I guess, about this project or this work is that it's peer-run, which is what Comwa does, of course, and so we're providing peer-to-peer navigation, helping people to navigate those complex supports and services, and often not necessarily just clinical supports, because we know that people's well-being can be improved by connection to lots of other community supports. Comwa has developed a database with this project funding that provides us with an enormous amount of information about the supports and services that are available in Western Australia. And what we're able to do is to support people to navigate through, and sometimes that might take several phone calls, because people will often not necessarily identify in their first call what it is they want. So it can be something as simple as, you know, is there a psychologist local to me that doesn't have a waiting list that's a year long? And it can be something such as, is there a community activity that I could belong to, and is there transport to get there, and is it low cost? And that might be, we've had things from knitting groups to dog walking groups, across the whole spectrum of community supports that help to provide people with wellbeing.
Since the service launch, what are some of the benefits that you and your team have seen? And I know your staff at Comwa are extremely proud of the service as well. So what are the benefits you've seen? And what's the thing that you and they are most proud of?
Since the service started, we've helped about 800 people. And often people are confused about the system and supports. They have complex needs. The thing that we're most proud of is that what we very much believe in is providing people with the skills so they can better self-advocate, so they can better support themselves. And so by providing them with a navigation plan and then encouraging them to make decisions about what it is best works for them.
And in terms of the people that are accessing the service, it's not just the person with the mental health issue.
No, it's this particular service also works with people who are carers, or we've had school teachers call up, we've had psychologists and GPs call up, the full range. And you know, that's being able to provide that information to these people obviously is wonderful.
What's the thing that they are so proud of and that you're proud of?
What we found is that people are coming back to us because they found the service helpful, their circumstances have changed, and they've come back for additional support in their new situation.
As the service has been operating, what have the learnings for you and the team been, and what are the plans for the future in terms of the Peer Pathways program?
I mean, I think one of the most significant learnings has been how many, particularly grassroots programs there are that provide a wide range of different opportunities for people. And often these are either grassroots, so they're not funded, or not particularly well funded. And so information about those services or groups isn't readily available. And what the team have found is that the more they gather that information, the more people they engage with, the more they exist. So that's been actually a little bit of a surprise, just how much is out there. The plans for the future are, we've been doing resource development for specific groups. We have been working a lot with people who are having housing challenges, and so more work to be done there. More work to be done in our regional engagement as well. And we know that traditionally people in the regions have less choice with their services and supports, but also have less ability to find out what is there.
Thanks, Sandra, and thanks for your time. We really appreciate it. And we will see you for the next Better Health Together. Thanks. Bye.